Hi, my name is Sherry Strite, and I'm here to tell you about a really big problem in healthcare. It's a shocking problem, and it's probably going to come as a really big surprise to you. And the result of it is that you and your loved ones may not be getting the healthcare that you need and deserve, and so I'm here to make you aware of the problem and to tell you what you can do to help improve this. Our focus is on physicians. However, the information that I'm going to provide to you really applies to any healthcare professional that you work with that might be advising you about your care. First, let me tell you a quick and yet really important story. Over a 4-year time period in the United States, and not so very long ago, an estimated 60,000 people died, and 140,000 people had heart attacks who otherwise would not, due to a really popular drug that was FDA approved. Most doctors didn't realize it was a problem drug, but they easily should have. The information was readily available, yet apparently not understood by doctors and not communicated to patients. My partner and I, along with some others, knew this drug was likely to be of little benefit to people and to be hugely risky, and we helped a lot of people avoid taking it. And the information about this problem drug was really very simple. We want to help you and your doctor avoid situations like this tragedy. We want to help prevent these preventable deaths and other harms happen to you. My partner, Dr. Mike Stewart, who is a family physician, and I have been spending many years studying and researching this problem. As a result, we are well respected in the medical community, and now we're going directly to patients to best help you. First, let's start with what we all want for our health care. We want quality information that's going to help us make decisions that are most right for us. We want our healthcare providers to respect us, to be concerned for us, and to care about us. And we want the right care in the right way at the right time. And there are a lot of things that we don't want to have happen as a result of our health care. Obviously, we don't want to die, be harmed, or suffer. We don't want to lose functioning. We don't want to lose our loved ones. We want to avoid any missed opportunities for the right care. We want to avoid wasted money, time, stress. And we actually risk all of this because of one really big problem in healthcare that is well documented but not very well known. Unfortunately, these problems happen way more frequently than you might suspect, and many of them are avoidable and potentially by you. At the beginning of this video, we gave you one example. Let's just add one more treatment to the mix, and now we're up to 123,000 people dead. Again, preventable deaths because of physicians not understanding some very simple facts about science and not communicating well with their patients. And so we want to help you by changing that. A lot of these people probably would still be around if they had known some really simple questions they could pose to their physicians and a few key facts about medical science that are really easy to understand. This one big problem in the way of your healthcare? It's not getting reliable or sufficient information in the right way to allow you to make the decision that is most right for you. And this one big problem is bigger than you can possibly imagine. But first, let's start with the foundation for good information for medical decisions. Good science results in more predictable healthcare outcomes, and good communications result in decisions that are going to be better for you. This big problem is what Mike and I call the big healthcare misinformation mess. Firstly, there's a high likelihood that the information that your physician is using is potentially not based on reliable science. We find that the majority of medical science is either not trustable or is of such uncertainty that one can't tell. And this is well documented by others, not just us. Also, we know there's a high likelihood that your physicians and other healthcare providers do not know this. We have a pretest that we give before our training programs in evaluating medical science, and over 70% of healthcare professionals fail that test, and it's pretty simple. And there's a lot of research on physician communications with patients, and what we find is that there is actually a very high likelihood that you are not getting sufficient information as well. So getting a little granular here, studies have shown that doctors focus on getting to treatment decisions, but frequently neglect the key details to give you the information that you need to make your decisions. So oftentimes they aren't trained to give you all of the available treatment options, including doing nothing. Frequently they don't give enough details about potential benefits, harms, or pros and cons of different choices. They oftentimes do not do a good job of eliciting your individual requirements, which should be the basis for your decisions after you get the information that you need. And further, a lot of research shows that healthcare professionals oftentimes don't check in with patients to make sure that they've understood what's been explained to them. So given all of this, we're aware that you need some help. And we want to help you. So we've written a book, and we have various tools and resources that we believe will help you with all of these problems. Our book is focused on making you aware of these problems, helping you prepare for your communications with your care providers, and helping you to better participate. And so we give you guideposts and lots of information, because we believe ultimately that you can change the conversations that you have with your doctors, the information that's provided to you, and the way that you think about your healthcare choices. We believe all of these things can help positively affect your healthcare outcomes. Our bottom line is that patients cannot give informed consent to medical interventions without reliable and useful information. And you deserve that to help you make medical choices that are right for you. And our book, our tools, and the information we give you can help improve your chances to achieve better care. In our book, we give you lots of insights. We give you insights into doctors and their worlds to help you better understand them. We give you insights into the major, and yet, as we said, little-known problems with medical science. We tell you about problems with medical communications in greater depth and detail. We also give you insights into healthcare as a business, because that actually can be hazardous to your health. And we give you insights into sometimes why what you think you want isn't really the best for you. For example, patients tend to overestimate benefits, and they tend to underestimate harms. Many are very surprised to learn that testing and screening is not necessarily in their best interest, and so we give you information about all of these things. And we give you information in a variety of ways. We tell you stories, we present some case studies, we give you very focused questions that you can use to shape how you want to communicate with your physician. We give you scripts, we give you tools and strategies, tips, advice, ideas, and lots of information. Here's what a few reviewers have to say. You can find our book at Amazon.com or through two of our websites, DelfiniGroupPublishing.com, and then our main website, Delfini.org. And at the first site I mentioned, we also have a link to freely available patient resources to help you. Thanks for listening. Our hope is that we can help you.